Welcome to this short session on neck examination, which is a simple guide to the examination of the neck. First, before you proceed to the examination, it's very important to take a good history. And this involves the swelling, history of the swelling, and whether it's localized or diffuse, the onset, acute or chronic, whether it is associated in pain, then progression, whether it is progresses fast or is progressive in size and symptoms. Then the other important one is pressure symptoms due to the size of the lump in the neck, and this includes hoarseness of voice due to recurrent laryngeal nerve involvement, dysphagia due to pressure on the esophagus, stridor or breathless, which is due to pressure on the trachea. The next to look for is altered function of the thyroid, whether it is hyper or hypofunction. Okay, we have the good careful history to assess the hyper or hyperthyroid functions are encountered in that patient. Then looking for metastasis in the cervical lymph nodes is the most important. The 6 or 7 groups of lymph nodes in the neck must be carefully examined and look for evidence of metastasis. And lastly is the constitutional symptoms associated with this: malaise, fever, loss of weight, and generalized feeling of unwellness. Having taken a good history from the patient, next we proceed on with examination, which consists of a number of steps. First is your introduction and greeting of the patient and proper positioning of the patient. The best position to examine is the patient sitting on a chair. So the thyroid or neck is examined from the front, inspection and palpation, and watching the movements of the mass on swallowing and protrusion of the tongue. After that, you inspect the neck from the side, and finally the palpation is done from the back with the patient sitting on a chair. The lump is palpated clearly, carefully to determine the shape, size, tenderness, movement, and whether it is mobile or otherwise. The next thing to examine from the back is the thorough examination of the lymph nodes of the neck. The 7 groups of lymph nodes from the neck, which I shall highlight in a short while. Then very important is, if it is a large goiter, it is very important to look for retrosternal extension by percussion below the clavicle on the affected side. Auscultation is very important to determine whether there is a bruit that is heard. The other one is hyper and hyperfunction. There are signs of hyperthyroidism and hypothyroidism are very important. The right number of symptoms and signs which can be detected on these patients. And lastly will be your special test, which I shall mention in a short while. Then you look for the signs on examination, especially the most important sign is a lump in the neck, and the most common of this is from the thyroid, which moves on swallowing, and it is the lump must be carefully examined by palpation to see whether it's a solitary or multinodular goiter, whether it is a diffuse swelling or nodular swelling. The location, consistency, movement, whether it is solid or cystic, whether it's fluctuant, and also the actual size of the swelling. Tenderness, another important sign to look for. So are the special tests or examinations, checking for the position of the trachea to see whether there's any tracheal deviation, retrosternal extension, which I mentioned just now, and evidence of hyper or hypothyroidism, and the presence of cervical lymph nodes, if enlarged, to determine which group of lymph nodes are enlarged. The special tests which I mentioned include the following list of them: Pizzilo's method, Pemberton sign, Berry sign, Cocker sign, Leahy's maneuver, Kryle's method, and Horner syndrome. So these are all important special tests that must be carried out. It's a special examination that must be carried out on patients with cervical lump, especially if you're thinking it is a thyroid lump. Okay, coming to examination of the lymph nodes, very important. I said 7 groups of lymph nodes. Here you see 1A and 1B, submental and submandibular. Then you got your 2A, 2B, then you 3, 4, 5, 5A and 5B, and 6. For the thyroid, the most important is your level 6 or anterior group of lymph nodes. Okay, and this can be shown again in this view here. You have got your posterior lymph nodes here, posterior triangle of the neck, parotid, submandibular, deep cervical lymph, superior deep cervical lymph nodes, inferior deep cervical lymph nodes, and deep to this stenomastoid will be the middle group deep cervical lymph nodes, which are very important. Okay, this is the anterior view of the deep cervical lymph nodes. Level 1, submental and submandibular. Level 2 is the upper jugular lymph nodes, or the upper level 2 will be the upper or superior deep cervical lymph nodes. Level 3 will be the middle deep cervical lymph nodes, and level 4 will be the lower, level 4 here, the lower deep cervical lymph nodes, superior, middle, and lower. And level 5 will be the posterior triangle lymph nodes. Level 6 is the visceral or the anterior group of lymph nodes here in the same compartment as the thyroid. And level 7 is the superior mediastinal lymph nodes, which is below the clavicle. Okay, what are the common causes of cervical lumps? Can be thyroid, 2 large groups, thyroid and non-thyroid. More common will be the thyroid lumps, which consist of adenoma, cysts, multinodular goiter, or diffuse goiter. Thyroiditis, various forms of thyroiditis, malignancy, papillary, follicular, medullary, and anaplastic, and lymphomas, either primary or secondary involvement of the lymph nodes. Non-thyroid origin will be cervical lymph nodes, which I told you, the 7 groups of lymph nodes, lipoma and sebaceous cysts, congenital conditions such as thyroglossal cysts, cystic hygroma and branchial cysts, and last but not least, metastatic deposits from elsewhere, especially from the abdomen, from the lung, and almost every other site may end up secondaries in the cervical region. Thank you very much for joining me for this ultra short session on neck swellings, especially thyroid swellings.